This is the Senate Committee on Healthcare. I'm the chair, Amy Gailey. And before we get started, let's introduce our Senate Sergeants at Arms, John Boyette, Gary Bridgers, Dwight Green, Linda Matthews, and Evan Stroud. Thank you, folks, for being here today. And then I believe we have some pages. If your pages would mind, please come into the microphone and introducing yourselves and tell us where you're from and who your sponsor is.
I'm George Merritt. I'm from Raleigh, North Carolina, and I'm sponsored by Senator Choudhury.
I'm Dutch Holland. I'm from Raleigh, North Carolina, and I'm sponsored by Senator Rabin.
I'm Fitz David. I'm from Wilmington, North Carolina, and I'm sponsored by Senator Michael Lee.
My name is Carter Britt. I am from Lumberton, Robeson County, and I'm sponsored by Senator Phil Berger.
My name is Blake Wilson. I'm from Raleigh, and I'm sponsored by Senator Adcock.
My name is Kate Hennon. I'm from Kinley. I'm sponsored by Senator Newton.
My name is Marky Wamper. I'm from Kingsbound, and I'm sponsored by Senator Ted Alexander.
Wonderful job. Thank you for being here. I hope you're having a good week and that it's been a good experience for you and that you've been learning some stuff and getting some nods. Great. Getting started, we are going to start with House Bill 437, and Senator Sari is going to present the bill. As we get started, I'll mention that we're going to run this committee real short today because we have session pretty soon, and also many of us have other obligations before that. So we're going to try to be as concise and to the point as possible.
Madam Chair, Senator Overcash and Representative Ryan are here as well. I'm going to let them talk briefly just about the bill and be very quick about it. Or actually, perhaps I'll defer to you.
Actually, I believe you have an amendment. Is that right?
I do have an amendment. Send for is H437-ADC-19 version 1 should be on the dashboard.
Could you explain the amendment?
Yes, Madam Chair. So the amendment is, we heard some concerns from Department of Health and Human Services about their ability to carry out some of the functions that was in the bill as amended yesterday in the Judiciary Committee. We heard those concerns. We are removing the Department of Health and Human Services from those inspection and compliance requirements and substituting in the Secretary of Labor, Commissioner of Labor, Commissioner Farley, the Commissioner of Labor in order to carry out those functions. That's the only change here, and I think that's the only reason it's in healthcare otherwise.
Great. Is there any questions about that amendment? If not, do we have a motion regarding the amendment? Senator Bergen has made a motion for adoption of the amendment. All in favor, please say aye. Aye. Anyone opposed? So the bill is before us as amended. Senator Sari, is it correct that the only remaining other health committee interest in this bill is in coordination with the local health departments, which that piece of the legislation would be found on page 3, approximately lines 22 through.
That's correct, Madam Chair. The only remaining piece is coordination with local health departments in the municipalities and counties where some of these sites are located. But that's it. Everything else was discussed thoroughly in Judiciary yesterday.
Wonderful. And Representative Ryan and Senator Overcash, do you have any information for the committee that's directed specifically toward coordination with the local health departments?
No, ma'am, unless there are questions.
Are there any questions about that part of the bill? Seeing none, is there let's see, is there where's my thing? We have a motion from Senator Moffitt for a favorable report for the bill as amended, unfavorable to the original, rolled into a new PCS with leave for staff to make technical changes and a referral to rules. Is that your motion? All right, all in favor of that motion, please say aye. Aye. Anyone opposed? Thank you so much. Motion carries. The next thing on our agenda is House Bill. We have one speaker on that. But we've already voted out the bill. So, and it was limited to, I'll ask Riley. Beg your pardon? You're good, he said. Okay, thank you. Thank you very much. Okay, so we're going to go next to House Bill 34, which is a PCS, and Senator Sari is recognized to explain the PCS.
Thank you, Madam Chair. PCS should be before you to House Bill 34. I'd ask for, adoption for consideration by discussion if there's no objection.
Do we go ahead and adopt the PCS before we discuss the PCS?
We can just discuss it, I suppose. Yes, that's fine. Sorry.
Okay.
Thank you. I apologize. I've got lots of paper in front of me. Thank you, Madam Chair. House Bill 34, I appreciate Representative Lambeth allowing us to use this as a vehicle. So it has several different provisions, and most of these provisions are requested by the Department of Health and Human Services with regard to things that they're seeing in the course of their evaluation of the Medicaid program for integrity and compliance. There's some changes with respect to licensure limitations for bad actors that are providers involved in the space, strengthens the medical credentialing committee, gives them more authority. It actually conforms current process that they're actually using with what the statute says and allows them to do. It also participates, it strengthens our Medicaid provider participation agreements as well. Four things I'll highlight on this I think are really important. It requires the providers to identify their electronic health record vendor, notify the department when they change that vendor. That's something that's important for investigations. If a law enforcement agency or MID is looking at some type of fraud or waste or abuse issue, they're going to look for where the records are stored. They need to know where to actually look. Requires each user of a provider's EHR to maintain a unique login. There have been issues that we've heard about where there's a single login being used by a provider group so that they actually can't track down who within the provider group is creating some of these issues. Another piece, and I think this is particularly important, especially if you saw the New York Times article, is that it requires the provider to notify the Division of Health Benefits within DHHS if a provider or somebody in their group is convicted of a crime. There was issues that were raised by the New York Times that talked about a company in North Carolina being charged with crimes that's in relation to the particular Medicaid practice they were engaged with, and I don't want to call out any particular company, but potentially there's a flaw there. We want to close that because we want to make sure that doesn't happen again. The last piece of the bill, and I think this is something that's that we've had a lot of conversation about, is we're proposing to close the networks for ABA services, peer support services, and community support services. These are service areas that have had some challenges, I'll say that, with different aspects of the program. Closing the network allows those that are already there to remain. There are some network adequacy requirements that LMEs and DHHS will have to undertake to make sure there's adequate services in the state of North Carolina. But in light of what these particular services are going through in the state of North Carolina, I think it's particularly important that we take this step, put down our marker, and allow the LMEs to more thoroughly vet people that want to enter into the space in North Carolina. Glad to answer any questions, but I know this is for discussion only. We're on a tight timeline. We'll definitely have time to talk about it next week.
Thank you, Senator. Sorry, was this PCS drafted with the input of DHHS?
Yes, Madam Chair. So DHHS, so several provisions, and let me just see here, I can highlight them. Section 1B is a DHHS suggested provision. Section 2B is a DHHS suggested provision. Section 3A is a DHHS suggested provision. I have reviewed, and I'm sure DHHS will jump in if they disagree with something I'm saying. Section 3B is a DHHS provision. We have discussed the closure of the networks of DHHS. We've discussed the other requirements for changes to the Medicaid provider agreements with DHHS. I did not hear an objection from them then. They might have had something else to say. I'm sure they're back in the room today and they'll jump in. But otherwise, I don't think there's any objection from DHHS with respect to this bill.
And pending feedback from this committee meeting, are you aware of any objection to the bill?
No objection to the bill. There is on the text of this, there is a change, I think some minor changes that were highlighted to strengthen some of the provisions that we'll probably bring forward as an amendment next week, but there will be technical, there won't be substantive with respect to what's in this bill. There might be some other things that are subject to discussion, but this bill will be substantially similar. And I do see Jansen nodding her head, so I don't think she disagrees with anything I say about that. She gave a thumbs up too.
Terrific. Do we have any questions or comments from the committee on this PCS, which is for discussion only? So if not, then this PCS was sent to members in accordance with Senate rules and is properly before the committee for discussion only. So thank you for that very good presentation, and we'll move on to the next bill, Senate Bill 978. Senator Bergen is recognized to present the bill, and I believe we have some amendments.
Thank you, Madam Chairman. What I would like to do, if it's acceptable, is to talk about the bill just a few minutes, and then I'll send forth. Then I'd like to talk about the bill for just a few minutes and send forth an amendment deal with that and then deal with the Second Amendment. Ladies and gentlemen, the committee, you all have heard us talk many times, and we've discussed how expensive health care is across the country, but especially in the state of North Carolina. Over 6 years ago, I started working on the idea of how do we make sure that consolidations are reviewed by someone, and who should be reviewing them. And at the time, I actually worked with the Attorney General, who is now our governor, and presented a concept. Since have changed it to add more people to it to be able to review. But basically what it would do is it would set up the Attorney General. Originally, I was asking the Attorney General, the State Auditor, and the Treasurer to be a review committee for any merger or acquisition of hospitals in North Carolina. After talking to the Treasurer at length about it, he feels like he would be conflicted out because of the state health plan, which is the largest health plan in the state of North Carolina. So my plan was to replace him with the Commissioner of Labor and perhaps the Commissioner of Insurance, so that we would have a group that dealt with a lot of these issues, that could review any of these acquisitions, say, is it a good idea or a bad idea? Is it good for the public? Are they getting compensated fairly? Look at all the different aspects, and you can read the bill, and it goes through, and so I'm not going to take the time to go through without that. But we know that hospital consolidation drives up cost of health care and can contribute to reduced competition and limited patient choice. When large systems acquire smaller providers, it often results in higher prices without necessarily improving access or outcomes. This section is intended to ensure that changes in hospital ownership and control are transparent and subject to appropriate review. In light of the developments that are going on right now, especially here in the Raleigh area, and ongoing discussions regarding a potential hospital merger, I have been asked and will be amending this provision out of the bill. So this first amendment I'm going to send forward will, if I can go ahead and send it, or do you want me to go ahead and explain it first, Madam Chair?
Please send forth your amendment.
Okay. Amendment is sent forth.
And then you're recognized to explain the amendment.
Thank you, Madam Chair. It'll remove pages 1, lines 2 through 6. It'll amend it and says, and title, an act to provide whistleblower and employment protection to healthcare workers and to limit the chief executive officer compensation for not-for-profit hospitals that receive state funds. But it'll remove all the section that applies to the review committee. So we're striking that and leaving in the whistleblower, employment practice, and executive compensation. And then it also puts the provision back in for dollars, $50,000, so that it makes it subject to the current stipulations on moving a bill right now.
Thank you. Do we have any discussion about the amendment? Seeing none, all in favor of adopting the amendment, please say aye. Aye. Anyone opposed? So the bill's back before us as amended. Senator Bergen, I believe you have another amendment. Do you want to do that one now?
Yes, ma'am, I will. The next amendment actually will exempt the state treasurer from DHHS review. Basically, we're exempting from CON. In talking to the treasurer and looking at how big the state health plans, I think we need to give the treasurer and treasurer's office some flexibility in how they approach health care. This would allow them to do joint ventures with someone, perhaps even purchase a hospital or anything they wanted to do to try to help control healthcare costs. It's almost impossible to get true, transparent pricing, and I think this would give him the opportunity, if he so desired, to be able to explore that. Be happy to answer any questions.
Thank you, Senator Bergen. I believe the amendment's on the dashboard, and does anybody have any questions? Senator Waddell.
Thank you so much. You said it would exempt the treasurer from being involved in it?
It would exempt the treasurer from state CON law.
Okay. Is there any reason for that? Because we do have some mergers going on.
Yes, ma'am. There is a reason to do that, is so that he, if he decided, could participate in such an acquisition.
All right. Thank you.
Any other questions about the amendment? Seeing none, all in favor of adoption of the amendment, please say aye. Anyone opposed? So the bill is back before us as amended for the second time.
Madam Chair, I'll be happy to answer any questions, and I know there's some folks that would like to speak to the bill.
Any questions from the committee? Senator Mayfield.
Yeah, thank you, Madam Chair. I don't have any questions, but I do have some comments that I'd like to make about the revised version of the bill, if that's all right. I'd like to be recognized for some comments.
You're recognized.
Thank you. The original version of this bill represents the culmination of many discussions with multiple groups and agencies about how to address the disaster that was the purchase of Asheville's nonprofit Mission Hospital by for-profit publicly traded HCA in 2019. The disaster represented by the deal is evident in both the process of the sale and its aftermath, and the original bill takes important steps to address both. Since we're only dealing with the provider protection provisions, I will limit my comments, but will provide a brief background for those who are not familiar with the Mission HCA story. In 2019, HCA purchased Asheville-based Mission Health. HCA is a for-profit publicly traded company that owns 189 hospitals, more than any other company in the country. Mission Health was a nonprofit system and consists of Mission Hospital, a roughly 800-bed tertiary care hospital and trauma center in Asheville, as well as 5 smaller hospitals scattered throughout the region, a rehab hospital, and a few other practices and facilities. As the only tertiary care hospital and trauma center in our 18-county region, Mission Hospital is a critical piece of our infrastructure. The transition of our nonprofit community-focused health system to a narrowly focused, for-profit-driven one has been nothing short of devastating to our community. We've seen a gutting of our tightly woven medical community due to the loss of hundreds and hundreds of long-serving doctors and nurses who have been replaced by traveling temporary professionals with no connection to each other or our community. We have also seen unprecedented and repeated enforcement actions by the Centers for Medicare and Medicaid Services due to quality of care problems. Since 2021, CMS has cited Mission Hospital 4 times for immediate jeopardy. For people who don't know, immediate jeopardy is the most severe regulatory citation a healthcare facility can receive, and it is uncommon across the country. Fewer than 3% of hospitals receive this citation every year. So for Mission, that's 4 times in 5 years, 3 times in the last 2 years, and 2 times in the last 8 months. Each of these immediate jeopardy citations involve patient deaths, a total of 9 people who could have gone home to their families, but for
Mayfield.
HCA.
I'm sorry.
I'm getting there.
I'm going to interrupt you. I think we have strayed from the text of the bill.
The background is important, and I am almost to the bill.
Okay, thank you.
I ask your indulgence. Thank you. Mission has also experienced 2 EMTALA violations involving an additional patient death. I will say here, as I always do, that we do not hold Mission staff, nurses, and physicians responsible for the problems cited by CMS. They are doing the best they can within a structure and with limited resources that reduce their ability to be effective. I also recognize that patients can and do receive excellent care at Mission, but 2 things can be true at once, and serious deficiencies in care clearly persist. The provisions of the current version of the bill address a limited number of issues related to these problems, and the fuller version, when we take it up, address even more. I will start addressing the current provisions by noting that the term healthcare professionals includes not just doctors, but also physician, PAs, APRNs, and RNs. So the whistleblower and non-disclosure sections of this bill are necessary because providers at Mission, including physicians, are afraid to raise their voices internally and externally about quality of care problems for fear of the consequences. We have seen employees fired after speaking openly with DHHS and CMS surveyors, and after indicating they were going to share with the public recommendations for improving care on which the hospital refused to act. We have seen nurses effectively forced out for daring to disagree with management and refusing to take unsafe assignments. And we saw Mission attempt to change its medical staff bylaws to make it easier to withdraw privileges if a physician spoke against the hospital. It is unconscionable that providers are not free to raise quality of care concerns internally and externally, and these provisions address that. The ban on non-compete clauses addresses the fact that we have lost providers who could not stomach working at Mission anymore, but then had to move out of Western North Carolina because of their non-compete clauses. The 4th part of this section, which actually appears first in the bill, limits the learned profession exception only to providers. The learned profession exception limits who can be sued under consumer protection laws. It traditionally extends to licensed professionals like doctors and lawyers who have licensing boards that handle discipline of licensed professionals. However, courts have extended this protection to hospitals, which are clearly not licensed professionals and should not, in my view, be exempt from consumer protection laws. So the effect of this provision is to expand consumer protections by empowering the state to go after hospitals that are, by virtue of their management decisions, creating unsafe conditions for patients. As you likely know, we have made bringing a medical malpractice case in this state very difficult, so most patients and families harmed by HCA's decisions at mission have little to no recourse. This would allow the state to determine if these decisions create unsafe conditions worthy of action in order to protect consumers and patients. And as I said before, the medical providers are not to blame for the problems at the hospital. Rather, it is the structure within which they work that creates conditions that put patients at risk of serious injury, harm, impairment, or death. In closing, I will say I recognize that other hospitals may view these provisions as a threat, but there is no hospital in North Carolina and therefore no community in North Carolina dealing with the quality of care concerns that we have at HCA Mission. We can, as a body, and should take action to protect patients and providers, so I ask for your support for this bill, and I'm also happy to answer any questions. Thank you.
Thank you, Senator Mayfield, for that summary. Are there any more questions or comments from the committee? Seeing none, we have anybody from the public who wishes to be heard on the bill? Please, sir, tell us your name and where you're from.
Thank you, ma'am. My name is John Thompson. I'm from the North Carolina Medical Society. We do not have a position on this bill as it is current. I do want to thank Senator Mayfield and Senator Bergen for soliciting input from the Medical Society when it comes to provider protections and in particularly on non-competes. The Medical Society opposes non-compete clauses in hospital employment arrangements because they decrease the essential patient access to care. They decrease the incentive for hospital systems to provide the best possible work environment for physicians. And with significant and growing physician shortages, we need to reduce barriers to practice change and ensure that physicians can continue serving patients in their communities without post-employment restrictions. Thank you.
Thank you. Anybody else from the audience wish to speak on the bill? Seeing none, Senator Britt has made a motion for a favorable report for the bill as amended, unfavorable to the original, rolled into a new PCS with leave for staff to make technical changes and a referral to judiciary. Is that your motion, Senator Britt?
That is my motion.
So all in favor of Senator Britt's motion, please say aye. Aye. Anyone opposed? Thank you, and the committee is adjourned.
Thank you, Madam Chairman and Committee.